Hi, everyone. My name is Leah Swanberg. I am the founder of Egg Helpers and Canadian Fertility Consultants, and welcome to our webinar. Today is January 8th, 2026, if we can believe it. And I am absolutely so excited to be hosting this webinar today and to be talking about my greatest passion, aside from my own family, which is surrogacy and egg donation. Next slide, please. When intended parents come to us or come to the decision of surrogacy and are looking for information, there is so much information out there. And we find that for so many, they tell us that they are just overwhelmed with the amount of information that they receive from their neighbor whose sister's cousin had a surrogate, from their family doctor who had a surrogate as a patient once 5 years ago. And so the information that I hope to provide today is really based on nearly 20 years of lived experiences of intended parents that have shared back with us what they wish they knew when they began their journey. When intended parents begin this process, their first stop should not be a surrogacy agency necessarily, should not be a lawyer, but it really should be with a medical professional who can assess their suitability. So, as intended parents, we want to know when you sign up with our agency, are you able to contribute to the genetics of your child? While it isn't necessarily important to us, other than it points us in the direction of where we're going to take you, it likely is important to you. So we suggest that intended parents speak to their family doctor about some basic testing. So a semen analysis, a sperm DNA fragmentation test. If you are a female provider, some testing around your fertility and hormone levels, whether that is an AMH test, whether that is an FSH test, whether that's an ultrasound to have a look at your antral follicle count or the potential number of eggs that will be available to you as you build your family. And all of that information is really important before you proceed, because for many, proceeding would not be possible unless or until. And the unless for many people is unless I can be genetically related to my child, I'm not moving forward. And until is around, okay, my doctor says I have a number of eggs and they all look pretty healthy on ultrasound, and I have some time to pause or decide or wait. And for male providers, fertility treatments have gotten so good that they don't need a lot, but they want to make sure that that what you have is as healthy as possible. So often they will suggest going off of, testosterone or any other hormones or things that may diminish your sperm quality. So they may suggest quitting smoking or cannabis use. And so all of that is good information up front, because once you come to the process and we know that medically you're in a place to move forward because you've decided that that it's right for you, then we would love to talk to you. I mean, we talk to lots of people before they do that, and we suggest a fertility clinic in their community or one that we know could help them whether or not they are providing their own gametes, so eggs or sperm. So welcome. You've done your homework. You're ready to go. You've made this decision as a single person, as a partnered person. In Canada, if you're outside of Canada and watching this webinar, we are a super open place, and we work with intended parents who are single, who are married, who are gay, who are trans, who are people who have had parents before, people who are in countries all over the world. We have an amazing system here in Canada that is happy to support you. And we have fertility clinics here that work with patients all over the world and are able to work with medical results that you've received where you are, and are able to accept embryos from wherever you are in the world if you have already started treatment. When you move forward with this process, I hope that this webinar gives you some basic tools, some basic understanding. If you have not, if you haven't looked at maybe some of these pieces yet, and this is the first time that you're hearing about this, please feel free to drop your comments in the chat on the right, or it's on my right. Yes, so it should be on your right. Please feel free to ask any questions as they come up. So first, I want to talk about, and for those of you who will be selecting an egg donor as you proceed with this process, we used to suggest selecting the egg donor, creating the embryos, and then finding a surrogate. And what we realized was that many people are looking for a very unique and special donor and a very unique and special surrogate. And so they end up looking for these people at the same time. And so as you're looking for an egg donor, really looking at what is going to provide you the best chance of one healthy child, two healthy children, three healthy children. We were looking at our stats, and I was very surprised to see the number of clients we've had over the years who are on child 3 and child 4 in our program. And it's just really, really beautiful to see how many people are continuing to grow their family in this really special way. So your fertility clinic, the clinic that you're working with, that would be next. So you've figured out your own sort of testing. You may have connected with us, or you may have a fertility clinic already in place. What's really important is to understand the fertility clinic's criteria of egg donors, and potentially if your clinic offers a guaranteed program. We see very often that clinics are, have an offering of pay one price and we will guarantee you a live birth. Pay another price, we will offer a guarantee of 2 live births. Another price is 2 live births, but 1 from each sperm provider in the cases of a 2-male couple. And what's important information for us as an egg donor program is if you are in a program like that, we know that the clinic has a specific criteria that the donor has to meet. As the clinic knows, if we're going to guarantee you, a number of children, that we need to work with an egg donor who can provide a large number of eggs. And so when selecting a donor, that's really important information. And so if you aren't at a fertility clinic, often at Egg Helpers, we will refer you to a fertility clinic. And then once you've selected whichever package you're going to work with, we then will have you review our database and only look for donors that meet that criteria. And so we want to make sure we have all that information from you so that we can help you select a donor that fits that criteria. So when we're looking at donors, all of our donors at Egg Helpers go through genetic screening. And as they do that, what's really important is that the fertility clinic is going to have you go through genetic screening as well. And what they're looking for is that the egg donor that you chose and your genetic screening does not overlap in terms of markers for any genetic conditions. These tests test 652 genes, and it is really important when going through this process to ensure that all of that is covered, that you have all of that information on the donor's genetics. The other implication, donors age, I mean, typically fertility clinics accept donors anywhere between 19 and 32 years of age. Their health history, you will see on Egg Helpers donor database, you'll see that the donors have all been already cleared to proceed at one clinic or another, and typically that's transferable. When we look at match factors refers to whether or not you are interested in an anonymous donor, an open ID donor, or a known donor. An anonymous donor would remain anonymous. Your legal agreement would have donor 1, 2, 3, 4, intended parent 3, 4, 5, 6. An open ID donor is someone who is willing to be known to you or known to your child when your child reaches the age of majority. An open donor, which I would say now about 80% of donors are willing to be known, is a donor that you meet if you live in the same city that she is donating, that you likely would meet and have an ongoing relationship with. All of the donors in our program will have legal representation, as will you, as it's a requirement of Egg Helpers and of most clinics. So when you're thinking about egg donation, really thinking about, what is the difference between privacy and secrecy? What information you believe would be important for a donor-conceived person? And then looking at research around egg donation or gamete donation, and what donor-conceived people are saying. I think that it's one thing to think about a pregnancy. It's another thing to think about a child, and as they move through their life, what information you will share with them and how you'll share it. When we look at that piece, it's really important as well to know that at Egg Helpers, we have a psychotherapist on staff who is accessible by you as intended parents, accessible to the donor, and is free of charge, included in our fee, as we believe the mental health, the psychosocial assessment, the pieces that oftentimes intended parents aren't sharing with their neighbor, their cousin, their friends, because there is really something to be said about privacy. And so having someone to really check in with, we have found to be just so valuable to intended parents. So I will move on from that. If anyone has any questions, please pop them in the chat. When we are looking at so you've selected an egg donor, you've signed the contract, she maybe has started her medication, or the embryos are created. If you're a superstitious person, many people say to us, like, I'm just too superstitious. I don't want to find a surrogate until my donor has completed the cycle and we have embryos. This is your journey, and we are just along for the ride. So when you're looking at selecting a surrogate, I really want intended parents to know a couple of things. And those couple of things are, as a surrogate, I carried 3 children starting 21 years ago, and have supported thousands of women as they go through the surrogacy process. And often, intended parents are curious as to why somebody would do this, and they're curious about who would do this, and they don't really understand that. And so I really want to say, as you select a surrogate, what's important is she healthy? What is her obstetrical history, which has shifted now in terms of fertility clinics accepting women who have not had children, because we know in today's society there are many women who are choosing not to have children and are interested in this experience. Emotional readiness. I don't know who is ready to be a surrogate ever, because there is nothing that can prepare you for surrogacy in the same way there is nothing that can prepare you for parenthood. We can read every book and blog and talk to 100 people who have been a surrogate or 100 people who are parents, and life happens as we move through parenthood or as we move through surrogacy. And so what I can tell you is that each surrogate has a unique reason for participating, whether it is to honor a sister who had breast cancer, and this surrogate signs up to carry for someone who is a cancer survivor, whether it is someone's keen interest in being an ally for the LGBTQ community, and they see this as their way. It is sometimes a woman who has donated blood 40 times and sees this as another extension of donating, and just helping someone, giving life, just as she has read, 40 times as she's walked in to the Canadian Blood Services location that she donates at. And so while that piece is unique to her, and you may learn about it and you may not, what we do know is that every surrogate that enters our program goes through a criminal record check, a conversation with her, and an interview. She provides us with a criminal record check, a social health history, and obstetrical history that we pass on to a fertility clinic that we trust, that we work with very often, to have what we call a non-medical screening provided. We have, again, at CFC, so Egg Helpers counterpart for surrogacy, we have a psychotherapist who also does consult with us on surrogates that enter our program and meet with surrogates and community to really ensure to whatever level we can that this surrogate is confident in her decision and able to proceed. So as you're selecting a surrogate, you as intended parents will receive profiles. We will ask you to complete a family brand building, which we have you go through a process to really go deeper around who you are as a person or as a couple. And we ask you to share photos and create a video and write a biography. We know that when intended parents put that work in initially, the match that they have is really so much more meaningful. And so we have you create all of that so that when you see a profile that you like, we then send your profile or your brand to that surrogate in order to make the match. And for us, we have people enter our program. They have a call with Jenna, who is our just fantastic journey guide. She as well has been a surrogate herself. You then go through this brand building piece, really understanding your story and your values and what you're looking for in a surrogate. Where does she live in Canada? Who is she as a person? What are her termination views? Immovable values that we know need to line up. Termination views, location. If you have donated embryos that you don't have a genetic link to, we know that there are places in Canada that we can and can't send you to find a surrogate. It is said in Canada that there's one surrogate for every 100 intended parents. I don't necessarily believe that to be true, but what I do know is intended parents who create a biography, are willing to be vulnerable and share and tell their story, that they will be successful in this process. When we look at the clinic management piece, one of the really valuable assets at CFC and at Egg Helpers that we have is that we are a staff of 32, and we have key people who work with your fertility clinic to manage all of the moving pieces so that you can focus on the most important relationship, which is that relationship with your surrogate. So whether it is cycle coordination with your egg donor, whether it's the embryo creation, transfer process to your surrogate, getting her from her city to the clinic, whether it is monitoring your surrogate or your egg donor in their community prior to them getting to your clinic. Clinics often will say that they do those things. Our experience is that they don't have time. And if you have been to a busy fertility clinic, that line is easy to draw. So our team that works on clinic management, our team that works on travel, our team that works on outside monitoring, all of that will be handled by us as your agency. And so really that's what we look at when we look at the medical aspects. We look at where is your fertility clinic, who is your egg donor, who is your surrogate, and how do we support you, the donor, and the surrogate within the clinical process. Next slide, please. What is our role? I often hear from intended parents at the end of their journey that they just really don't know what we did, and that, aside from matching them and providing them updates on their reimbursement account with their surrogate or egg donor, they weren't sure. And we know that we've done our job when intended parents don't know what we did because it just happened. And, I always say it's kind of like when you walk into the room and someone's cleaned it and you don't know how it happened, but it's clean. And that's, sort of more for the husbands that are on this call. If you look over at your other husband or at your wife, you know what I mean there. 90% of what we do is with the surrogate and the donor. 10% is with you as intended parents, with 100% of the outcome is the success of a healthy child at the end. And so when we go through the matching process, you're just saying yes. We're then taking your brand and we're, sitting down on a video call like this with your surrogate, and we're going through your brand with the surrogate, and we're talking about you, and we're sharing your story, and we're sharing what, that you have embryos or that you don't, or that you would terminate or that you wouldn't for a medical abnormality or Down syndrome. We are looking at those values and really ensuring that there is a fit before an introduction is made. With journey coordination, we want to make sure that your surrogate is supported in the clinic, your egg donor is supported in the clinic, the outside monitoring piece I spoke about, as well as logistical support. Where is she going to deliver? Who is going to be her OB, midwife, family doctor, care provider? We work with surrogates over the last, nearly 20 years we really know who's who in most cities in Canada, to really ensure that the surrogate's care provider is one that is surrogate friendly and will be open to communication with intended parents. And so as we're coordinating the journey, really emotional support, your surrogate has a coordinator, you as intended parents have a coordinator, we have our psychotherapist available. We want to make sure that all the way through you have the tools and that your surrogate has the support. We know that the theoretical risk is that a surrogate wants to keep your baby, which hasn't happened in Canada before, which is good news and bad news because it hasn't happened. So we don't know what the outcome would be, but every lawyer we work with tells us that the outcome is that the parents are the parents and that there's a contract in place, which again goes to journey coordination and logistical support. We make sure your lawyer has everything they need to know about the surrogate, including pay stubs and information and, her views and values, so that in drafting the contract, it saves time and money. And we make sure that the surrogate's lawyer is one that works well with your lawyer. And if you don't have a lawyer, we find you one. But all of that comes into that logistical support. And for many surrogates, they tell us, I've never seen a 30-page contract. And so our job and your coordinator's job is really to prepare her for that appointment with the lawyer by just, walking her through what all of these terms mean, what the topics, in a contract are, what her obligations are, what her responsibility and role is in this as what is yours. And we don't give legal advice, but we happily sit with surrogates to go over the process with them, whether it comes to the clinical process, the legal process, the life insurance application, whatever it is. We want to make sure that, we're an iceberg. 10% is intended parent, 90% is surrogate. And so that logistical support is, is for all aspects of the journey. And ongoing support, we know that postpartum depression happens. We know that gestational diabetes happens. We know that pregnancy complications are 20% higher when someone is participating or has an IVF pregnancy, and specifically a surrogacy. And so we make sure that as part of our agency fees, and I'm very proud to say we're the only agency with this, the psychotherapy that you or your surrogate or you go to together is covered under your agency fee. And that's there because we see that as so important. We can do logistics, we can do support, but therapy we leave to the professionals, and we have one on staff full time. So ensuring that your surrogate is supported so she can make the best decisions. And back to my point that I skipped over, theoretical risk is that she's going to keep your child. And again, that's not happened. Real risk is that your surrogate develops mood disorder or a prenatal depression or postpartum depression. And our role is really to limit her exposure to factors that would exacerbate that, and ensuring that she has support should she struggle in any way throughout the pregnancy. One other logistical piece, we manage the receipts and reimbursements, ensuring that they're in line with Health Canada's Assisted Human Reproductive Act. And in doing so, we ensure that we take that heavy lifting off of you. And for many, the financial process is complicated, and we have an app for that. So we developed an app to ensure that surrogates had a way to easily upload receipts, that they would have an easy way to track their mileage and other expenses that came up. And they take a photo of it. It goes to our finance team of 6 people. They review them and get the reimbursement up to the surrogate the same day. We have a very low barrier process around finances to ensure that we are available by text, by email, by phone to our surrogates, and ensuring that they are very comfortable with bringing themselves forward with what they need in terms of expenses, and that you as intended parents have information along the way to ensure that you understand where your funds are going, and they are paid in increments throughout the pregnancy. As well, we understand the enormous cost and commitment financially, and so we want your money in your pocket as long as possible, with the understanding that we have made commitments to the surrogate in terms of us having the money to ensure she has her expenses reimbursed. If anyone has any questions, if people want to pop them in the chat. Oh my gosh, okay. I apologize. I was in the wrong chat. So I will look at these questions here quickly. Okay, so I'm going to go through these questions at this point and then I'll move on. Um, First question, you do not have to have more than an embryo. I imagine that you meant more than one embryo to start the process. No, you don't. We have intended parents who have one embryo and are creating embryos. We have intended parents who are waiting for Ontario IVF funding to open, which it has. So if you are in Ontario, please send me an email. I would love to get you into a clinic that I know has funding spots available. But no, one embryo is all you need. Okay, next question. Is it possible to transfer an embryo internationally? Absolutely. We work with Core Cryo and we have worked with them again for nearly 20 years. And they pick up embryos from all over the world. What we have learned over this time period is that some countries, some places in Australia have ethics committees that require a review of where people are engaging in surrogacy and that it needs to be altruistic. So then at that level, we accept embryos and we will work with you to provide any paperwork from the fertility clinic or legal professionals to ensure that all of the documentation meets the needs of whatever committees or processes within your country. Okay, next question. Which clinic does genetic testing? So if it is genetic testing of yourself and the egg provider, that is done typically by, there's two companies, Natera and iGenomics, and it depends on which fertility clinic you're using. If you're talking about genetic testing of your embryos, that is done either in your clinic if they have a genetics lab, or in the clinic that you select if they have a genetics lab, or embryos are sent to the US for testing and sent back. And the differentiator there is that clinics in Canada cannot gender select embryos. And so for people who are doing family balancing or looking to select gender, our suggestion is, and we can help coordinate this, is that you create your embryos in Canada, send them to the US for testing, and ask that only the male or the female embryos be sent back. And we manage that process every day. And so, leave that to us if that's something that your question. Okay, to add to that last question. I don't see the last question, but it's just an egg possible from another country. If you have purchased eggs from an egg bank, yes. If you are looking to purchase eggs from an egg bank, we have an egg bank in Canada. It's called Egg Bank Canada. You can check out their website. We are also a part of that bank, and we have many hard to find or diverse donors there. And I will say, if you are coming to Canada from outside of Canada, please check out Egg Helper's website. We have donors from all backgrounds, and we're really proud of our diversity in Canada, and it really shows on Egg Helper's website, as we have South Asian donors, Black donors, Chinese donors, Filipino donors, women from all over the world who live in Canada and are participating as donors. Okay, I already have three. Okay, I already have 3 euploid 5-day blasts in Brazil. Oh, wow. Yes, they can be transferred to Canada and transferred to a surrogate. We've worked with many people in Brazil, and absolutely, we can accept embryos from Brazil. It's very easy. Absolutely. Yes, Melanie, this is being recorded, and I am so sorry that I didn't get to these questions until now, and we will be sending out a recording. Catherine, yes, we can transfer your eggs to Canada. There is no problem there. Again, wow, okay, this is the $1 million question. What is the percentage of first embryo transfer resulting in a full-term pregnancy? For a really long time, I could easily say it was 80%, or it was 80, I think it was 82% and 74% live birth based on 2 transfers. And we have seen a shift in that we're working with many different clinics. And so to have a stat on that is tough, because each clinic has different protocols, different criteria, different success rates. But what I will tell you is that, we see 1, we see 2 transfers. Sometimes we see 3. You know, out there on Instagram, all the doctors have been talking about this recently, that it takes 3 embryos to make a baby. And if you're using an egg donor or an egg provider under 35, that it takes 2. And I don't know if that's true or not, but I keep hearing it everywhere. And so I would say to you that we are committed to your success. Your surrogate is committed to your success. Your donor is committed to your success. And so all of us will work together to leverage every opportunity for success. Oh, hello, George, in Quebec. Well, let me tell you, we have lots of amazing Quebec surrogates. And because of the new laws in Quebec, Quebec intended parents or Quebec surrogates can only work with Quebec intended parents because of the law in Quebec that is just a year and a half, I think, in practice. So please reach out to us, because we have available surrogates in Quebec. And as I said, they can only match with Quebec intended parents. Our business model, we are everywhere. We are on blogs. We are on Instagram. We are in community with women. We have a program called Sacred Surrogacy, which is my heart's work. We travel to cities across Canada and host weekend retreats that, again, are part of your agency fee. Surrogates come to us, and we have the largest number of surrogates in Canada because of our community. We don't reimburse surrogates the highest expenses. We don't have a guarantee of a successful pregnancy, but what we do have a guarantee of is committed community members who show up for other surrogates. And so in Quebec each year, we run a retreat. We run one in Nova Scotia, in BC, Alberta, in Manitoba. We're in Saskatchewan on January 31st. So our business model is, again, this 10% 90. The 90% of our connections in community are not with you, the paying customer, but with surrogates, because we know that without surrogates, we don't have a program, and we really want to care for and connect with them. So check out Sacred Surrogacy on Instagram or sacredsurrogacy.com. You will learn about our differentiator at CFC, and it truly is. And at Egg Helpers, because we have sacred donation. It truly is that. Okay, does CFC have access to egg donors and or surrogates outside of Canada? We don't, and we work with affiliate programs for those intended parents who are looking to do surrogacy outside of Canada. We have organizations that we work with in the US as well as in Mexico. Both places I've done retreats through Sacred and have met just the most amazing surrogates, and we gladly refer people to programs that we know care for surrogates in the same way that we do. I answered this one already, but I'm going to answer it again. The surrogate does not need to necessarily have children anymore. We have seen the same success rate with surrogates who have had children as to who have not. Our criteria is a little different. Our requirement is that the surrogate is 30 years old if she doesn't have children, that she undergo a different and additional psychosocial assessment to ensure suitability. We put more support in place around pregnancy health, prenatal nutrition, and therapy throughout. And we have seen just really great experiences. And again, we have this great community that really just Loves on our no kid surrogates in the same way as they do surrogates who have had kids. Fabio, is it possible to have 2 embryos fertilized? Oh, sorry, Catherine. Would it be possible for a potential surrogate to travel to the US? Well, listen, theoretically, yes. And we are finding that based on some media probably about a month ago, where US Customs at the Calgary, Alberta airport stopped a surrogate from traveling into the US because they deemed her going to the US for employment, even though surrogates aren't paid in Canada. They deemed her taking a job away from a US surrogate, even though it's not a job there. It's not a job here. And so we have engaged a US immigration lawyer, and we are trying to get, ahead of that. And, we are seeing fewer surrogates interested in traveling. And so we say to intended parents, leave your embryos there until you find a surrogate. And if you find a surrogate that you love who's not willing to travel, your embryos will travel. And if we are able to find a surrogate who's comfortable traveling to the US, that's great too. Okay. Is it possible to have 2 embryos fertilized by different sperm? Yes. During the same pregnancy? No. We are a single embryo transfer program, as are most clinics. We know that twin pregnancies are not necessarily safe. I wouldn't put someone in an airplane without a parachute if they were jumping out. And so the same goes for surrogates. We are single embryo transfer only unless the egg provider is over 35 and the fertility clinic deems it safe, given that likely only one embryo will attach. And creating embryos with 2 sperms. So we collect the donor's eggs, half are fertilized with 1 sperm, the other half are fertilized with the other sperm, and then 1 embryo is transferred from one dad, and then second dad goes next. We have many tandem journeys going. A tandem journey is 2 surrogates at the same-ish time in hopes to have 2 kids very close together. Can intended parents and surrogates be cross-province? Absolutely. I would say 90% of our matches are intended parent lives here, surrogate lives there. And I find for many intended parents, it with technology now, they're really not missing out on as much, attending big appointments if possible, or being involved through FaceTime, Teams, attending doctor's appointments virtually. We do find that most people are from a different province, and almost always the surrogate is traveling to a clinic outside of the province in which she lives. And same with the egg donor. Melanie, I'm not sure what you mean when you say wow, because it's required in California. I want to say that's probably genetic testing, but I'm not sure. Can you transfer your eggs to Canada and have embryo procedures at a clinic? So yes, at a clinic. We aren't a clinic, so we're a surrogacy and egg donor program. I just use 1 or 2 mature embryo. Yes, absolutely. Many people, will ship all of their embryos to the clinic that they're going to work with. And sometimes it's, you see a profile of a surrogate named Jenny. She's done this before. She'll only work at clinic XYZ. So you're sending your embryos from Vancouver to Toronto to clinic XYZ, and you may only ship 2. You may ship all of them. Really dependent on, are you in a guaranteed program? What makes sense? And we will talk you through all of those pieces to make sure that you're making the best decision to leverage the best success. What happens if a pregnancy must end suddenly? So we see miscarriage nearly 20% of the time, often before 6 weeks. And that is a statistic about IVF. not surrogacy, but that's what we see. And so, the surrogate is immediately offered support through our therapist. You, as intended parents, are immediately offered support. We want to have a deep dive with the clinic to talk about, is this an embryo quality issue? Is this the surrogate, rejecting this embryo because it's not hers? What is this about? And how do we go forward with this surrogate or another surrogate with a different result? Alexis, I would love for you to email me more context on your question. How many embryos the clinic takes can our normal PGTA? I'm not sure what you mean there, but if you email us, we'd love to answer that for you. Okay, you may be fine. Can I share how cost works? Absolutely. When intended parents come into our program, they pay a $2,500 administrative fee to set up their profile and to set their branding and get ready for the process. Our agency fee is only due after the match and is not for the match. It's for the management of the process. As in Canada, it's illegal to be paid for matching. So we introduce you and you pay us after. Our agency fee, and then we ask for the reimbursement account to be funded in 3 parts. Once matched, to get you to pregnancy, once confirmed pregnancy, to get you to 25 weeks, and then another amount to get you over the finish line. And we can send you all of that as well. We are a Canadian organization, and someone asked the estimated fee for the whole process in US or Canadian. For us, it's really hard because some people have embryos, some people need an egg donor, some people are going through embryo donation. Sometimes you're with one surrogate and she doesn't get pregnant and you're going to another surrogate, and it takes 2-3 tries, and you'll spend $20,000 in travel and screening and all of these things before pregnancy occurs. So it's really important to get our information package, and Aaliyah, when she sends the recording of this, she'll send that and it'll kind of break all of that down. But we don't have a guaranteed fixed cost, sort of as we see in other places. But we do work with you. One tip I'll give you, please talk to your insurer at work to see what alternative family building benefits you may have. If you live in Canada, look at provincial funding, tax breaks for IVF. If you are employed for self, talk to your accountant about an HSA or a health spending account that you can pay for your surrogacy and pre-tax money as opposed to post-tax money. If you have a drug plan, know that fertility clinics in Canada put the receipt in your name because you have benefit for the outcome, which is the child. And so fertility medication for an egg donor and a surrogate can be $8,000. If you have 80% coverage, there's money there. So if you move forward with this process, book a call with me. I have this call with people all the time, which is just a financial review of, how the money is going to come together and where sort of hidden money is based on where you live, where you work, are you self-employed? How many surrogates do we currently have? Aaliyah, do you have that number? I want to say we have about 350 in active cycles, and that would be leading up to pregnancy, pregnant, or up to 12 weeks post-birth. And then we always have a number of surrogates coming into our program. Our goal every month is to match 40 intended parents, and that's 25 new clients and 15 clients who have had a match break or unsuccessful transfers, and the doctor has said, hey, you need a new surrogate, had a miscarriage and they need a new surrogate. Whatever the reason, we're really working all the time on balancing those two things. And when someone has had unsuccessful transfers, when there has been a miscarriage, we treat that and triage that as quickly as we can, with the knowledge that it is harder to match after tragedy happens, because surrogates really often are worried, is it the embryos, is that going to happen to me, am I not going to get pregnant? So actually, myself and Aaliyah, who hosts this webinar with me, she works with our intended parents who are in those situations along with me, so that we can work to get you matched as quickly as possible. Because we have had many months where many people have been added to that list. And we don't talk about rainbows and sunshines here. We talk about the reality of IVF for people who have not experienced the reality, also known as sometimes a real punch in the face or a punch in the gut. And so we really work with people on the reality of this process, which is beautiful and wonderful and deep and enriching, not only for you as people who will become parents, but for the surrogate. And it doesn't always go as planned. Has there been issues with embryos being damaged? In nearly 20 years, we had one case, and one clinic said that the embryos were great when they left. The other clinic receiving them said that they weren't great quality. But it's very rare. These shippers, this is their only job. There are companies that do hand carry. There are some intended parents who have literally carried the shipping container on the plane from wherever they live to Canada or interprovincially, because they really just want to ensure that everything is very, very safe for them. Oh, thank you, Aaliyah. 350. I was there. Okay, if it's not legal to pay for a surrogate in Canada, how is your program designed to respect Canadian laws? I will say confidently, having been the only agency in Canada charged under the Assisted Human Reproduction Act, the only Canadian company who pleaded guilty to 2 regulatory offenses, which were paying surrogates and egg donors without the proper accounting, 12 years ago. I take it very seriously. And so we have spent a lot of time at the table with Health Canada. They've had sessions for professionals, really learning about what is an acceptable expense. You aren't paying the surrogate, but you are absolutely reimbursing her for pregnancy-related expenses. And that typically can be $25,000 to cover her expenses through the pregnancy, whether that's additional groceries, mileage to from appointments, housekeeping, childcare, wage loss for appointments, and other items that are even outside of that $25,000. So surrogates in Canada do receive money. It's not taxable. It's not income. We have had many intended parents submit their receipts to the Quebec government now, as it's a requirement in Quebec, and the government has accepted it. And we felt very confident in the way in which we manage surrogate receipts and expenses. The average waiting time, it really depends. So I will say right now we have very few heterosexual couples in our program. And so a heterosexual couple may not wait so long, or a single woman may wait, a really short time if there's a single mom who really wants to sort of show up in community for a single soon-to-be mom. But I would say on average, people wait about 6 months. And then if they need to find another surrogate, we really hope that will be 6 to 9 months. But again, it depends on sort of the nature of their coming back to find another surrogate. If it was embryos, if it was miscarriage, how we're going to rebrand your family story to elicit a response that will have a surrogate become very curious about you and interested in working with you. Yes, Catherine, Core Cryo was amazing, but actually the fertility clinic in Canada organizes it, because what happens is the Canadian clinic sends their shipping container to your clinic and provides information on what is required to be in the shipping container, and then they ship back with the eggs or embryos. And we're happy to help coordinate that for you and find a clinic that meets your specific needs, as every intended parent that we work with really comes to us with a set of needs that is unique, and we want to make sure we meet their needs. We have not had issues getting embryos from the US to Canada at all. We've shipped a lot. I mean, during COVID, I will say that Canadian clinics got a real lift, increasing their success rate by nearly 10%, because the US clinics that were shipping embryos into Canada had extremely high success rates, and we're shipping to clinics local to the surrogates because the surrogates weren't traveling during COVID. And so some of these smaller centers that weren't really maybe as advanced really became advanced very quickly, and ended up having some great success rates to publish. Is that it for questions? Aaliyah, do you want to go to the next slide? I think that was it as slides, but I'm unsure. Oh, no, here we are. The legal framework in our program does not guarantee a surrogate match. Sorry, I'll just answer one last question. And I'm getting questions also sent by people that are on this story through our Instagram. So just one moment. So we don't have a guarantee to match in a certain time frame, because for us, we don't know what that's going to look like for you. We don't know if you're, what your criteria are, what you're looking for in a surrogate. But we do work with intended parents to really create the best brand to ensure that they have the most draw for surrogates. And do you work with Create Fertility Center? We work with every fertility clinic in Canada that has a primary establishment process in place, which allows them to work with surrogates. The legal framework in Canada, we're almost at the hour, and I clearly have talked way too much. Surrogacy is federally regulated, as I mentioned earlier regarding my case. And so we work with lawyers across Canada who, if you are outside of Canada, will work with your lawyer in your part of the world to ensure that the legal contract contemplates any language that's required for people in the EU. A known donor or a donor that has traceable information is required. And we know all of that over these years and with the lawyers we work with in Canada, but it's important that you know it's important for us that you know how you are engaging is accessible for you in the location that you live. Contracts and agreements. You will have a contract with your egg donor. You will have a contract with your surrogate, who will also have a lawyer to review that. Both lawyers are in Canada. The lawyers that we work with give free consultations, and once you're tucked away in our program, we're happy to refer you to a lawyer that we know does a wonderful job for intended parents. The jurisdictional impact of where your surrogate lives, how long you'll need to be here. Most clients are out of Canada if they live somewhere else in 3 weeks. With a Canadian passport, birth certificate, all documentation stating you are the parents, whether you are a one-parent, two-parent, even three-parent family, if you have a surrogate in BC, British Columbia. So legally, you will become parents of your child. Your child will be a Canadian, and if you're interprovincially traveling, so from British Columbia to Ontario or vice versa, typically people leave within 7 days of their child being born. It's not enough for us to refer you to a lawyer for getting the contract, but at that same time, we're going to talk to you about health insurance. Your lawyer will talk to you about that as well. We have the most amazing social health care. Your surrogate will be pregnant and covered for the pregnancy as she would be with her own pregnancy through our social health care. But anything leading up to the pregnancy, tests your fertility clinic requires, etc., that will be at your cost. And when the baby is born, they don't meet the residency requirements to become a Canadian. Therefore, they don't get Canadian healthcare. We have amazing access to insurance, newborn insurance, that depending on where you live in the world, we will refer you to as well. Next slide. I think that was the last slide. Thank you. I feel like I could have talked on, and I love your questions, and I'm so glad I found them in the chat. If we have a friend who is willing to be the surrogate, can she undergo the embryo transfer, and would she be required to give birth in Canada? I love that you may have a friend that could be your surrogate. I think that's really special and very sweet. And if surrogacy isn't allowed in your country, then I guess yes. But many people travel to Canada for IVF and go home because where they live, their fertility clinics don't do surrogacy. And so we're happy to coordinate and support that as well. We have, is it okay to transfer eggs from Hong Kong? Yes, we have had so many amazing relationships with intended parents in Hong Kong and surrogates in Canada and clinics in Hong Kong, working with clinics in Canada. Absolutely. Answer is yes to that. Okay. If you have any other questions, please put them into the chat. Aaliyah's going to send this recording out. We have decided for 2026 that we really wanted to create an opportunity to have more intended parents. We see so many places, limiting the number of intended parents that join their program in Canada. And what we know for sure is that if we gatekeep you, we gatekeep the surrogate. And surrogates come to us and they're looking for something very specific, or they want to look at lots of profiles of intended parents to really find out who it is they want to help. And so we are opening our program to intended parents right now and offering a $500 discount in our egg donor program and $750 agency fee reduction in our surrogacy program for people that sign up between now and the end of February. So please, when you message us, remind us you were a participant on this webinar so we can get that money into your account with Egg Helpers or CFC. We are just so grateful and, pride ourselves on the great care that we take of our surrogates, which we hope inspires you as intended parents. I'll leave you with this. We know that taking care of your surrogate is taking care of your baby. And the most important person in this entire process is the child that will result from this process. And so we really want to encourage you as you begin to think about this, as you begin to dream of parenthood, to really dream of how you see yourself showing up for your surrogate in order to show up for your baby that we hope will be here for you in the coming year. Puerto Rico. You know what? Never worked with intended parents from Puerto Rico. So welcome to our webinar, and hopefully welcome to Canada to have your baby. Aaliyah popped my name. Yes, Finland, absolutely. Egg donor from Finland. Many of our clients will have their egg donor live where they live because it's a sister, cousin, friend. And they will come to Canada and we will coordinate for them with the clinic and hotel and, take care of them and make sure that they have everything that they need while they're here as well. So again, thank you everyone. My email, Aaliyah dropped into the chat. And also Aaliyah will send this recording out, as well as our intended parent information package so you can familiarize yourself with it. And I look forward to hearing from you in the future, and best of luck on your family building.